Hi everybody and welcome. My name is Neil Seidman and I'm co-chair of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. Welcome to our webinar, Depression and Heart Disease, Chicken and the Egg, and What You Can Do. And our presenter is Dr. Valerie Hoover. So before we start, I'd like to say just a little about ADAA, the Anxiety and Depression Association of America. ADAA is the leading nonprofit organization in the field of anxiety and depression. Our mission is to improve diagnosis and promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education, like this webinar, through clinical practice and research. And one really important idea is we really want to end stigma and get the word out that these conditions are common, they're real, and they're treatable. I want to invite you to visit the ADAA website. It's a really amazing resource. That's adaa.org. One of the things you'll find right on the home page is a link to Find a Therapist, which has a wonderful directory of treatment providers. And we also have a free peer-to-peer online support group that you can also find right on the home page. And also on the home page, you can click a donation link to make a charitable donation to give some support for just some of the many activities of ADAA. Okay, so let's get started. And I'm really happy to introduce our presenter. Valerie Hoover, PhD, is a licensed clinical psychologist and clinical instructor in the Division of Cardiovascular Medicine at Stanford University School of Medicine. Dr. Hoover specializes in working with patients on issues like depression, anxiety, adjustment difficulties, and life stress that impact cardiac health. And she also works with patients on changing habits around food, exercise, and sleep to better manage cardiac risk. So let me turn it over now to Dr. Hoover, and let me bring up Dr. Hoover's PowerPoint. So let me turn it over now to Dr. Hoover.
Okay, thank you. So I'm very excited to be here today talking about this important topic of depression and heart disease, two very common conditions. And as a little bit of an overview, we'll start off by talking a little bit about what coronary artery disease is. Then we'll be looking at the chicken and the egg question. So does depression lead to heart disease, or is it heart disease that leads to depression, or is it neither of these, or is it both of these? So we'll be looking at that. Then we'll be talking about depression and the role that it may play as a risk factor for poor prognosis among individuals with coronary artery disease. And then we'll be finishing up by talking about what you can do, even starting today, to manage your cardiac risk. Okay, so first of all, I just wanted to start off with a little bit of basic anatomy of the heart. So when we're thinking of the heart's anatomy, I like to think of the analogy of a house. So inside the house, inside the heart, we have different chambers, and you can think of these like similar to rooms in a house. And so in this diagram here, we have, you can see the right atrium. It's in blue on the top left there. And so this is where deoxygenated blood from the body is collected. And from here, it's passed down into that right ventricle. And from there, it gets pumped out and over to the lungs, where there's an exchange of gases. Specifically, there's a offloading of carbon dioxide and oxygen gets picked up. Then from here, it gets returned to the heart into the left atrium, and that's in red, the top right. And from there, it goes down into the left ventricle and then gets pumped out of the heart through the aorta, where it's pumped throughout the rest of the body. And there's also, you can see them here in this diagram, there's a couple of little arteries that branch off of the aorta that supply blood directly to the heart muscle itself. Okay, and next we have the veins and arteries, and this is akin to the heart's plumbing system. So arteries, as a rule, carry oxygenated blood away from the heart, so I think arteries away from the heart to the rest of the body, and veins return the deoxygenated blood back to the heart and lungs, and then the whole process starts all over again. Then last but not least, we have the electrical conduction system of the heart. And this is responsible for sending electrical messages across the heart muscle, which causes the different chambers to contract, which allows for the movement of the blood throughout the heart and the body.
Well, you really take the mystery out of the heart, Dr. Hoover. I like your analogy to a house and the different rooms in a house, and then explaining. I like the way you explain how the heart pumps the blood, returning the blood that needs oxygen, picking up the oxygen in the lungs, and then the heart sending it back out to where it's needed. And then I like your analogy of the plumbing system and then the electrical system.
Yeah.
That's great.
Yeah,
Shall I go to the next slide?
Yeah, you can go to the next slide. Okay.
Oh, there we go, the light bulb, okay.
All right, so I want to zoom out and talk just for a moment about cardiovascular diseases. So this is kind of the broadest category. And as a whole, cardiovascular diseases are the #1 cause of death in the United States. They're responsible for about 1 in every 3 deaths. And some examples would be hypertension or stroke. And then when we zoom in to the heart itself, there's a collection of heart diseases. And so you can see these appearing here, and I'll talk just for a moment about some of these different ones. So we have cardiomyopathies, which are diseases of the heart muscle, and are often associated with the heart becoming enlarged or thick or rigid, and this can cause issues with the with blood being able to circulate properly and the different electrical impulses that travel across the heart muscle. Then we have arrhythmias, which are problems with that electrical system in the heart. There's congestive heart failure, or sometimes just referred to as heart failure. And this is a chronic condition that affects the heart's ability to pump enough blood throughout the body. Then we have valve disease, and this occurs when the heart valves between the different chambers become hardened or leaky, and blood ends up getting restricted as it moves through the chambers, or sometimes it doesn't move in the right direction. Then we have something called pericarditis, and this is just simply refers to an inflammation of the lining around the heart, which is called the pericardium, and it's made of these 2 thin kind of sac-like structures. So when they get inflamed, we have pericarditis. Then we have congenital heart defects, and this refers to a class of different kinds of abnormalities in the heart that develop during birth. Then lastly, we have coronary artery disease, or CAD. And this is really where we're going to be focusing most of our attention today. For shorthand, I'll be referring to this sometimes just as CAD or even just heart disease, but I wanted to make it explicit that when I say heart disease, I'm referring specifically to coronary artery disease. Okay. So what exactly is coronary artery disease? So one of the things that can occur pretty much anywhere in the cardiovascular system is a buildup of a waxy substance called plaque. And plaque is composed of a number of different types of substances, including fat and cholesterol and calcium, among others. And this is something referred to as atherosclerosis when this builds up. And when that buildup of plaque occurs in those coronary arteries that supply blood to the heart, that's when we have coronary artery disease. So at the top of the diagram, you can see a normal artery, and it's nice and clear. The passageway is open, and blood can move easily through that vessel. On the bottom, we have a artery with plaque buildup, or atherosclerosis. And so you can see that substance lining the vessel, making it more narrow. And so this can be a problem for a couple of reasons. So one, that narrowing reduces the amount of blood that can flow to the heart muscle. Also, those plaques can rupture and create a clot that either partially or even completely blocks blood flow to the heart muscle. And if that happens, if that blood flow to your heart muscle is significantly reduced or blocked, you may experience a symptom called angina, which is another name for severe chest pain or discomfort. That pain may also spread to the shoulders or the arms or the neck or the jaw. And if the blood supply to the heart muscle is restricted for long enough, the affected part of the heart muscle can actually die from lack of oxygen. And that's what we refer to as a myocardial infarction, or sometimes it'll just be referred to as a heart attack.
Okay, so myocardial infarction is like a technical name for a heart attack, but usually is related to what you're showing here having to do with the plumbing system.
Yeah, exactly. So the technical term is myocardial infarction, and sometimes you'll hear that referred to as a heart attack. Yep.
Okay.
Okay. So also wanted to talk a little bit about some of the different risk factors for developing heart disease. And some of these are not modifiable. They're fixed. And some examples would be a family history of early heart disease, and this is defined as like if you had a father or a brother who had a heart attack before age 55, or a mother or a sister who had one before age 65, that would put you at increased risk. Also for men, being over age 45 is a risk factor, or for women being over age 55 or postmenopausal. Also for women having high blood pressure or a history of preeclampsia during pregnancy. And there's autoimmune disease is a risk factor, as well as a history of certain types of cancer treatments, specifically radiation and certain forms of chemotherapy. So one of the things I want to emphasize here is that you may see that you have maybe one or two or more of those non-modifiable factors. And if that's the case, it does not mean that it's inevitable that you'll develop heart disease. What it does mean, though, is that you want to be extra careful to manage your modifiable heart disease risk factors that we see on the right-hand side. So those are some of the traditional ones are physical inactivity, smoking, being overweight or obese, following an unhealthy diet, for example, a diet high in saturated fat or trans fats, substance misuse, for example, excessive use of alcohol, uncontrolled high blood pressure, unhealthy cholesterol levels, meaning high levels of LDL or bad cholesterol, or high levels of triglycerides, or conversely, low levels of good cholesterol, or HDL. And then also uncontrolled diabetes or prediabetes is another modifiable risk factor. And then one of the things that the main thing we'll be looking at today is, to what degree is depression? Can depression be included on that list of modifiable risk factors for heart disease?
Okay.
Okay. So this next slide features a study that was published just last year that I included because I think it does a really nice job of underscoring that point I mentioned just a minute ago, which is, even if you have some of those non-modifiable risk factors on board, it doesn't mean that you necessarily have to develop heart disease. Some of those modifiable factors can play a really big role on your risk. So in this study, which came out of the New England Journal of Medicine, they looked at the relationship between genetic risk for heart disease, adherence to 4 healthy lifestyle factors, and cardiac events in over 55,000 patients. And those 4 healthy lifestyle factors that they looked at were not smoking, having a body mass index under 30, in other words, not being obese, having physical activity at least once per week, and following a healthy dietary pattern. And so if you can advance the slide. So what they found is, not too surprisingly, is that both genetic and lifestyle factors were both related to the risk for heart disease. The more interesting thing that they found is that even among those individuals who are at the highest genetic risk for developing coronary disease, if they followed at least 3 of those 4 healthy lifestyle factors, their risk for experiencing a coronary event was almost half. So again, I think this just really highlights the importance of maximizing those factors, those risk factors that are within our control.
Well, this sounds like a very dramatic relationship between, we hear these things, that this is good for you and it's going to protect your heart, but this study, it sounds very dramatic, that all I have to do is not smoke, be under the threshold for obesity, but I could still maybe be overweight and still get a check mark on that box, and have a decent diet and or a little bit of physical activity, and that has really a dramatic effect on my my risk.
Mm-hmm. Yeah.
Very interesting.
Okay. So now we're going to look at that chicken or the egg question. So does depression lead to heart disease, or does heart disease lead to depression? And before we dive into that, I want to just make sure we're on the same page when we're talking about depression and what that is, what we mean by that. So, we all have times when we feel down, and it's normal to have some fluctuation in our moods from day to day or even within the day. And this is really distinct from what we mean by clinical depression, which is essentially when someone is down and really stays down over a significant period of time. And so to actually receive a diagnosis of depression, a person must have at least 5 or more of the symptoms that you see here on a majority of days over at least a 2-week period. And so they are, as the label or the name implies, a depressed mood, feeling down or depressed, less interest in your usual activities or deriving less pleasure from those activities, changes in appetite or weight, and this could go in either direction, so either being hungrier or weight going up, or the opposite, going down. Changes in sleep, again, in either direction, sleeping more than usual or less than is usual for you. Changes in what we call psychomotor activity levels. So, and again, this can go in either direction. So feeling kind of sped up or like an agitation, or feeling really slowed down, either way. Feelings of worthlessness or inappropriate or undue guilt. Problems concentrating or thinking clearly, maybe feeling kind of foggy mentally, trouble making decisions. And certainly thoughts of harming yourself or thoughts of suicide. And this could, be anything from kind of a passing thought to having a plan and the intention on carrying through on that plan. And I wanted to just make a plug here for the National Suicide Prevention Hotline. So this is a wonderful service, and it's available 24 hours a day, 7 days a week if you are in crisis, and that number is on the bottom there. It is 800-273-8255.
I think that's a great resource just to have handy for in the event that a friend or loved one could, take advantage of that resource. And I think I just want to make a comment that you don't have to be in the crisis at that moment to be able to call. They're happy to get calls. So I just think this presentation is really helpful to see what does it mean to have a diagnosis of clinical depression. We use that term depression. I don't feel good, I feel depressed, I feel low. But to really meet the diagnosis, 5 of these things are going on for at least 2 weeks. And I guess all these are pretty recognizable for most people. The 3 that look kind of interesting, I just wanted to point out to our audience, is that 3 of these 8 items have to do with physical things that you could experience yourself or you might see in a loved one or a friend. A change in appetite or weight either way, not eating or binge eating. A change in sleep either way, sleeping all day or not sleeping at all. And then a change in psychomotor, so physical activity level. I'm lying in bed all day doing nothing, or lying on the couch all day for day after day. Or how common is that one, Dr. Hoover, where people that have depression are actually look very agitated and moving around all the time, but it could be a symptom of depression?
Yeah, absolutely. It can go either way. And, traditionally when we think of depression, we, might think of being slowed down or like a lower level of activity. But it can certainly go in the opposite direction as well. It's an excellent point.
Yeah. And then the last items here, feeling worthless, guilt, suicidal thoughts, those are pretty easy to understand. And then the last one, number 7, difficulty concentrating or making decisions could be one of the symptoms of the 5. Excellent.
Yeah. And so moving on, I wanted to talk just for a moment about the, how common is depression both in the general population and among cardiac patients. And so this graph here is of the point prevalence of depression, and point prevalence refers to basically how common a certain condition is over a certain period of time. And I believe in this, for this particular graph, I want to say it's a 1-year period. So in blue, we have the general population. So it's down there around maybe 6 or 7%. And compare this to the presence of depressive symptoms in cardiac patients, and you can see the number is quite a bit higher, closer to a little over 30%.
Wow, that's like 5 or 6 times the rate. So that you're really showing here on this slide, there's definitely a strong relationship between depression and cardiac health. And then your title for your webinar, well, in which way does that relationship go? And maybe it goes both ways.
Yeah, exactly. And so, just like you said, so we don't really know, this doesn't say a lot about, cause and which might cause the other, but we do know that they definitely co-occur. And I would also say here that There's a lot of different estimates of the rates of depression in cardiac patients, so there is some variability, but approximately around 30% or so. Okay. So this is the first part we're going to be looking at of that chicken or the egg question is the extent to which depression is a risk factor for developing heart disease. And so this first study is what's called a meta-analysis, and it's a type of study where researchers pull together all of the available studies on a particular topic, and then they focus on the results from the highest quality studies to then draw a conclusion. And so in this meta-analysis, the authors included 30 studies that looked at that link between having depression and the likelihood of developing heart disease over time. And across those 30 studies, they had a total of almost 900,000 patients from around the world, including the US, Europe, Hong Kong, Taiwan, and Canada. And at the very beginning of the studies, about 18% of all patients were classified as depressed, and the remainder were not depressed. And the studies then followed patients from between 2 years on the low end all the way up to 37 years on the high end. And during that follow-up period, they looked at the number of CHD or heart disease cases that were reported, and in total there were about 59,000 cases that were reported. Okay, so one of the things they found is that depressed patients had about a one-third increased risk for experiencing any heart disease event, and about a 30% increased risk for experiencing a myocardial infarction specifically. The other really interesting thing that they found is that even after they adjusted for other factors that we know influence heart disease risk, this effect was still significant.
So even after they adjusted for things like smoking and diet and being obese, they took those factors aside, they still found a relationship with depression.
Yeah, exactly. And so, of course, they weren't able to adjust for all of the things that we know contribute to heart disease, but they were able to, kind of isolate to some degree the unique effect of depression, and found that there seems to be something unique about depression that contributes to heart disease risk.
Okay.
So this is another study looking at that question of depression and the degree to which it might contribute to the risk for heart disease. And so in this study, it was conducted in Australia with about 860 women over an 18-year period. And at the beginning of the study, 17% of participants were classified as depressed, so very similar to the last study, and the remainder were not depressed. And what they found is that over that 18-year follow-up period, about 1 in 10 women experienced at least one heart disease event. Can you go forward? Thank you. Yeah, so at least 1 in 10 women had at least one heart disease event during that 18-year follow-up period. And similar to that last study that we looked at, they found, oh, I'm sorry, I'm jumping ahead. So what they found were that women who were depressed at the beginning of the study were at about double the risk of having a cardiac event over that 18-year follow-up. 2 times the risk. Mm-hmm. And what I was going to say is that similar to the last study, what they found is that even after they accounted for some of the other factors that are known to contribute to the risk for heart disease, there still seemed to be a unique effect of depression. Okay. So this, now we're going to look at the other side of that chicken or the egg question. So to what degree does having heart disease increase your risk for developing depression? So this is a study that was conducted with males and females who were hospitalized after something called a coronary artery bypass graft, also known as a CABG. And just briefly, this is a type of surgery that may be done when a coronary artery has a significant blockage. So the researchers evaluated the patients for depressive symptoms before that surgery, early after the surgery, which was 1 week later, and late after the surgery, or 6 months later. And so what they found is that rates of depression were higher at all time points among females compared to males, but in both females and males, there was an increase in depression symptoms when you look at the time before the surgery compared to 1 week after, compared to 6 months after. The other notable thing about this study is that individuals with increased depressive symptoms were also more likely to have experienced complications of surgery. So that definitely seemed to be playing a role in this study.
So this study seems to show the relationship going the other way as well.
Exactly. Yeah, so it looks like depression can contribute to heart disease, and it would seem that heart disease can also contribute to depression. So this is a study that included about 79 patients who had experienced a myocardial infarction that had been treated with something called percutaneous coronary intervention, or PCI. And again, just briefly, a PCI is a procedure in which a cardiac catheter is inserted and a balloon, a very small balloon, is deployed to reopen the narrowed artery. And sometimes a stent is also inserted to keep the vessel open. So those are the patients that were included in this study. And what we can see, so along the bottom, we have 1 day, 3 to 5 days, 3 months, 6 months, and 12 months after they came to the hospital with their myocardial infarction and had that procedure done. And on the left-hand side, we have the presence of depression. So day one, when patients are coming to the hospital with this medical emergency, we see about a little over 20% of them, 21.5%. And I'll also mention, so we're looking at the red line on top. The red line is depression symptoms, and these authors also looked at anxiety symptoms, which is blue on the bottom. Yeah, so what they found is that depression symptoms were at about 22% when patients first came in. And then by day 3 to 5, this is usually around the time they're looking at discharge, they've gotten some relief from those physical symptoms they were experiencing. So they're feeling a little better. So depression goes down to about 9%. And then as time goes on, 3 months, 6 months, a year later, we see this number kind of creeping up again. It doesn't get back as high as it was, but it's going up. And it's not entirely clear why that's the case. There is some thought that that it can take some time for patients to maybe fully realize some of the consequences of their heart disease, or maybe they're dealing with some of the changes in their physical functioning after their heart attack, or in some cases even some disability caused by the heart disease.
Okay.
So we need more research in that area, but it does seem that that link between depression and heart disease goes in both directions. Let's talk just for a little bit about some of the reasons why we may be seeing that link. And broadly, we can think of them as both, there's kind of the behavioral explanations or mechanisms for that link, and there's also some biological, some possible biological mechanisms. and these are not exhaustive lists. These are just some of the top ones. So, and the other thing I would mention too about these mechanisms that we'll be talking about in just a moment is that they are correlational. And that's important because we can't say for sure that it's the cause of that link, but we can say that it's a common factor and that they're associated. Okay. So some of the behavioral possible explanations for that link that we're seeing. So we know that depressed patients are less likely to engage in health-promoting behaviors, for example, being physically active or following a healthy diet. They're also less likely to adhere to their medical treatment recommendations. For example, more difficulty attending appointments, maybe less adherence to some of their cardiac medications. And then there's smoking. So we know that depressed patients are more likely to smoke. Based on 2015 statistics from the Centers for Disease Control, it's estimated that around 40% of adults with moderate to severe depression smoke, compared to about 15% in the general population. It's a much higher number.
And that was one of the direct independent risk factors for cardiac problems.
Yeah, exactly. Yeah. So then some of the possible biological mechanisms. So in both depression and heart disease, we see increased vascular inflammation or inflammation of the vessels, and it's thought that this may contribute to the development of atherosclerosis. We also see dysregulation of what's called the autonomic nervous system in depressed patients, both with and without heart disease. And in particular, we see overactivation of a branch of that called the sympathetic nervous system, which is the branch that's responsible for the stress response, or also known as the fight, flight, or freeze response. And overactivation of the stress response has been associated with higher rates of mortality in patients with a history of myocardial infarction. And then another possible mechanism is increased platelet activity and aggregation. Platelets are a type of blood cell that circulates freely through the bloodstream. And when there's a plaque rupture, they start to clump together, and this can partially or totally block the artery, reducing or totally cutting off the blood supply to the heart. So again, not an exhaustive list, but some of the things that we think about when we're trying to understand why that link might be present, and certainly an area where we need some more research. Okay, so now we're going to turn our attention to the question of, is depression a risk factor for poor outcomes or a poor prognosis in people who already have heart disease? So this is a study that included almost 900 patients who were hospitalized for a myocardial infarction. And I'll just kind of walk you through this graph. So on the bottom, you see is time since discharge and the myocardial infarction. So 0, so like right when it happened, 300, and then 1, 2, 3, 4, and 5 years after that. On the left-hand side, we have the percent of basically survival, cardiac death-free survival. And then in the middle, we have the survival rates based on severity of depression when they first came into the hospital with that myocardial infarction. And so that top line where it says BDI less than 5, no depression. So these are patients with no identified depression when they came into the hospital with their myocardial infarction. And you can see that they have the highest rates of survival across those 5 years. And then at the very bottom are folks with a severe level of depression when they first came into the hospital, and they have the highest rates of, or the lowest rates of survival over that 5-year period. So a pretty striking study that does suggest that that depression is associated with a worse prognosis. Okay. This is a statement that was released by the American Heart Association a few years ago, and it was a review. The American Heart Association conducted this review to determine if they should formally recognize depression as a risk factor for poor prognosis following what's called acute coronary syndrome. And acute coronary syndrome is any condition that suddenly stops or drastically reduces blood flow to the heart. So for example, myocardial infarction, unstable angina, so chest pain that occurs at rest or with very little physical activity. And acute coronary syndrome is typically caused by heart disease. So in this review, the authors included 53 individual studies and 4 meta-analyses from countries across North America, Europe, Asia, and Australia. And if you can advance the slide, yeah, thank you. So what they concluded is that when they gather all that evidence to get together, the preponderance of the evidence supports the conclusion that depression after acute coronary syndrome is a risk factor for mortality from any cause, for mortality specifically from cardiac causes, or for cardiac events that are non-fatal. Yeah, so it's officially been elevated to the level of a risk factor.
Okay, so you answered that question. It had a question mark in the beginning, and it doesn't anymore.
Yeah.
That's very strongly connected.
Exactly. And so actually, sorry, if you can go back to that for 1 second. So it is notable that they stop short of recognizing it as an independent risk factor. And what that means is, remember back to some of those earlier studies we were talking about, so they didn't rule out the possibility that it might be related indirectly to some of those other risk factors that we were seeing. So we need more research in that area, but it certainly does appear to be a risk factor.
Yeah, good.
Okay. So now we're going to spend the rest of our time talking about what you can do to reduce your cardiac risk. Very, very important topic. Okay. So first I want to talk about, really what we'll be looking at is, we know that depression is a risk factor for heart disease and that people with depression and heart disease have worse outcomes. So the question then is, if you treat the depression, does it prevent heart disease? Does it lead to better outcomes? And so first I want to talk about medication treatments for depression. So this is a meta-analysis that included a total of about 2,400 patients from North America, Europe, Australia, and India. And the study looked at cardiac outcomes for patients who were treated with a class of medications called selective serotonin reuptake inhibitors, or SSRIs. It's a commonly prescribed class of depression medication. And the patients in these studies were followed up anywhere between 12 weeks on the low end up to 29 months on the high end. And one of the things that the researchers note is that despite the large number of individuals worldwide with both of these conditions, depression and heart disease, the authors were only able to find 6 randomized studies that looked at this question. And even of those 6 studies that they were able to identify, there were some pretty significant methodological issues, so we should take these results with a grain of salt. So what they found is that these SSRI medications were associated with significantly greater rates of depression remission during the follow-up compared to patients who did not receive the SSRIs. So this is essentially saying that the medication did what it was supposed to do in terms of helping to treat the depression, which is good. And they also found some evidence that SSRIs may improve heart disease-related mortality, heart disease-related rehospitalization rates, and mortality from all causes. But we really need more studies in this area and quality studies in this area to answer that question satisfactorily. Okay. So I also want to talk about psychotherapeutic treatments for depression. So this was taken from a Cochrane review that was just published this year that included 35 randomized studies with a total of 10,700 people with heart disease. And patients were followed for as little as 6 months up to 10.7 years. Most of the studies that were included focused on group treatment of depression, but some of the studies looked at a mix of individual therapy and group therapy, as well as individual therapy only. And there was quite a range of different psychotherapy treatment components and types of treatment, and 3 studies even included medication when it was appropriate. So really a mix of treatment components. So what they found is that treatment with psychotherapy was associated with improvements in depression and anxiety and stress. So again, the psychotherapy was doing what it's supposed to do, which is good. They also found in patients who received psychotherapy a 21% reduction in cardiac mortality. And they did not find any change in risk for mortality from other causes, revascularization procedures, or non-fatal myocardial infarctions. And so just have to kind of insert this caveat here again. So, a number of these studies had some significant methodological issues. So we want to take this with a grain of salt, but it does seem to suggest that there might be something to this, that if we can treat the depression, it may have an impact on heart disease outcomes.
Okay, good.
Okay. Right, so wanted to talk about one more study on this topic. So this study looked at depression treatment and mortality 1 year after a myocardial infarction. So it included a little over 4,000 patients in 25 hospitals across the U.S. And there wasn't there's nothing they had these patients or the staff do differently. So it was care as usual. What they did do, though, is before patients were discharged, they documented the depression and treatment status. So patients were documented as either having no depression, there was no presence of depression, or they had depression and it was treated, or they had depression but it was untreated. And the way they defined treated was in the chart having a diagnosis of depression, a referral for medication for depression, or a referral for therapy. So what we don't know is how many of these patients actually followed up on those referrals and got treatment, but for the purposes of the study, that's how it was classified. So what they found is that mortality rates in patients with no depression and depression, but that was treated, were no different in terms of their mortality rates. However, there was a difference between mortality rates in patients with untreated depression, and the mortality rates were higher when compared to mortality in patients with either no depression or treated depression. So again, this does suggest that if we can treat the depression, it's going to have a favorable impact on heart disease management. Okay. So, let's say, you or someone, a loved one, has heart disease, or they're depressed, and they want to be able to manage their risk. So what are some things that you or they can do? So one of the first things would be to, if you think you're depressed, talk to a therapist, talk to your primary doctor, and they can help provide some guidance and resources. Another thing that you could do to manage your risk would be to increase your level of physical activity. And we know that this is a potent, a powerful thing to do, both when it comes to managing your heart disease risk and also for managing your mood. And there's a whole other wonderful talk on here by Dr. Otto on physical activity and mood that you can definitely check out to get more information on that.
You can find that on our webinar page at ADAA, and also on the YouTube page.
Yeah. And so another thing you can do that's within your control is to build in more things that you find enjoyable or meaningful. When we become depressed, one of the things that often happens is that we might feel more tired, or we might feel less interested in things than we used to, so we kind of stop doing those things that give us meaning and pleasure. And so it can lead to that downward spiral. So to help reverse that spiral, it can be helpful to start reintroducing some of those things that used to mean a lot to us or bring a smile to our face. Okay, another important thing that you can do is to if you have an existing support network, to reach out and use it. And if you don't, to start building in some of those supports. And this could mean having a listening ear. It could mean someone to get some encouragement from, or it can mean help with specific tasks or challenges that you're facing. So for example, let's say you want to be able to go to your weekly therapist appointment, but you need childcare, asking a friend or a family member. It's just one example. Or having a spouse wash the dishes if they're so inclined, so that you can get your walk in the evening, things like that. Okay, and then certainly last but not least is managing your modifiable heart disease risk factors that we talked about earlier.
With diet and exercise and smoking and addressing weight issues to some extent.
Exactly, yeah, and if you have high blood pressure that's not being controlled, talking with your doctor about that, uncontrolled diabetes or prediabetes, all of those things that we have some control over to better manage.
One thing that I find very interesting here is that some of the factors and things that we can do that address depression also address cardiac risk, like exercise, right? And
most
smoking,
definitely.
diet. Yeah.
Yeah, exactly. So it's things that are good for our heart disease, managing our heart disease risk, or also tend to be pretty good for our mood. And then in conclusion, just wanted to leave you with some key points from today. So the first is we know that depression occurs pretty commonly in patients with heart disease, much more so than in the general population. And we know that it's not really a question of chicken or the egg, it's really chicken and the egg. So depression can is associated with an increased risk for developing heart disease. And if you have heart disease, it's a risk factor for developing depression. We also know and saw that when you manage your, even if you have some of those non-modifiable risk factors like genetic risk or an early family history of heart disease, it doesn't mean you are destined to develop it. It does mean that you want to really take charge of those modifiable risk factors, which can have a really big impact on your overall risk for developing heart disease. Another thing we learned today is that so depression is associated with worse outcomes following a cardiac event, poorer prognosis. And there does seem to be some research that suggests if we can treat that depression, whether it's with medication or psychotherapy or both, that we may see improvements in the cardiac outcomes, but we certainly need more research in this area to really be able to answer that question. And then lastly, I just want to leave you with this. So there are many treatment options and effective treatment options for depression, and many things that you can do to actively manage your cardiac risk. There is hope, and help is available. Thank you.
Well, thank you very much, Dr. Hoover. Wonderful presentation. And I want to invite our audience, if you have questions, feel free to send an email to webinars@adaa.org. That's webinars@adaa.org. You can write Dr. Hoover in the subject line, and based on her availability, she's happy to address your questions. So bye for now, everybody, and we'll see you next time.